Welcome to the IAEA headquarters in Vienna, Austria. This is Alejandra Silva, and today we will be talking about cancer in Africa. Cancer is a growing problem all around the world. It affects people regardless of age, gender, or social class. In Africa, many people die of conditions that are treatable because access to radiotherapy and other advanced forms of treatment are very limited. The IAEA works to help developing countries in their fight against cancer. The agency provides technical support and trains medical staff to work with radiotherapy. Today, we have one of our experts. She's come back from the field, and she's with our reporter, Louise Potterton, talking about the situation of cancer and treatment in West Africa.
I'm joined by Kirsten Hopkins. Thank you, Kirsten. Kirsten is a cancer specialist working in the Division of Human Health at the IAEA. You recently returned from Mali in West Africa. What was the purpose of this trip?
Well, Mali are a low-income country, but currently have one of only 4 working government radiotherapy machines in West Africa. And that's a region that in total is about 350 million people. So I wanted to go there and see their service, see the infrastructure and the equipment and the human resources they have, and also discuss with them what are the challenges and what would be their priorities for their next project working with IAEA to be able to develop and expand their service.
So this is one radiotherapy machine for treating cancer for millions of people.
Yes.
So if you live in a neighbouring country, for example, you then have to travel to Mali to get cancer treatment.
Yes, indeed. They have people going there from Burkina Faso, Côte d'Ivoire, I think occasionally from Gabon, although Gabon have development going on, but I gather they come from there as well, probably Niger. Most of these countries have plans for development, but at the moment Mali are actually taking a lot of external referrals.
One of the problems in Africa is also that people actually go to the doctors when the cancer is already at quite an advanced stage, which obviously limits the effects of treatment if treatment is indeed available. But why is this? Why do people wait so long?
I think it's a number of things. It's lack of access to diagnostic units. So you talk about going to the doctor, like you or I would go to the doctor back in the UK, but in a rural community with very little exchangeable money to get a bus, well, maybe hundreds of kilometres to your nearest city that has a referral hospital, it's actually very difficult to go and present. It may be lack of awareness. I don't think people are stupid. I think a lot of the time they know something is very bad, but there's a nihilism because treatment services aren't there, or the other people that they know with that disease have died. And so why would you spend your money, why would your family spend your money taking you to the hospital when they don't have adequate services and you're going to die of it? So I think it's a bit chicken and egg. I think that if you work at putting in the services, then people will seek them out. And I've certainly seen an example of that when we put in an early diagnosis screening unit for cervical cancer. The gynecologist commented that women started coming earlier because they felt there was something to go to where they might actually be able to do something.
So once they know that these facilities,
Of course you can speed that process. They will hear about it. It gets around and they start coming, but you can speed that up by public awareness campaigns, try and go out. I've said that there aren't doctors, but there may be rural health workers who know how to diagnose malaria. That's often everywhere in Africa. You can go for a rapid diagnostic test. So train those people how to recognise what are common signs of cancer and who should they tell them to go to see, so that they need to know a rapid referral pathway, if you like. It's the most basic rapid referral to teach. So I think that public awareness, staff training helps, but actually it does, what you need is somewhere for them to go to.
So do many actually see cancer as a death sentence?
Absolutely.
Is that how it's perceived?
Yes,
yeah,
absolutely. Well, unfortunately it is. That's the reality
when
of
you've
it.
not got the facilities, yeah.
When you don't have the facilities.
Okay.
And that happens all over the world, but when you put the facilities in, people do seek them out. There is a very strong survival instinct.
What is the survival rate for cancer if you do get treatment, adequate early treatment?
in the UK now, more than half the people who are diagnosed with cancer will be cured of it.
If you've got the facilities.
Yes, if you have the facilities. And that should be true. We'd like that to be true all over the world.
So what are the main impressions from this trip? What really needs to be done? It seems it's quite severe lack of facilities at the moment. So what are your main recommendations?
I mean, there's an absolutely inhumane lack of facilities, actually, in sub-Saharan Africa generally. There are facilities at the north, along the north coast of Africa and in South Africa, and there's an awful, dreadful area in the middle which is either severely lacking or has no machines at all. So we need development of radiotherapy services, but obviously that has to be safe development, and that's partly what our organisation IAEA is about, is how do you use nuclear technology safely. So that needs an infrastructure for safety and regulation of use. And then countries that have either had no facility or very limited facilities, I hope, benefit from the experts' advice and services in terms of development of the infrastructure, the equipment and the human resource training that's needed to make it safe.
Yeah, I read that 80% of Africans don't have basic access to radiotherapy.
Yes.
But could you just explain in simple terms what exactly is radiotherapy and why do cancer patients need it?
Well, radiotherapy is a highly effective, it's the use of ionising radiation to kill cancer cells and thereby kill tumours and save patients' lives. And it's quite an old modality compared to chemotherapy. It started being used almost as soon as X-rays were discovered, which I think was 1895, and by 1896 someone tried to use them to treat breast cancer. So right from the beginning we saw a reason. Actually many of us, but it was always considered to be associated with side effects, and those side effects sometimes limited its use. If I go back to the beginning of my career, I thought radiotherapy would be gone by now. I thought it would be useless. And actually it's not true, because what it needed was better information technology to target it and deliver it more safely. And if you look at what's happened to the world in the last 30 years, the explosion of information technology has actually meant that we have amazing ability in high-income countries to deliver very safe, effective radiotherapy. So it's still the case today that about 40% of patients who are cured of cancer have radiotherapy as their only treatment or as part of their treatment. And I would say we mustn't forget that patients everywhere will sometimes present with advanced disease, and radiotherapy is highly effective at treating some cancer symptoms like severe pain and bleeding and discharge. So there's an overwhelming need. In high-income countries, we would say, so I come from the UK, about 46% of people with cancer benefit from radiotherapy at some stage of their disease. If you go to Africa, actually ironically, that need is greater even though the provision is less. So probably about 60% of people need it, and that's partly because many patients present with very advanced disease and need the palliative benefits. But it's also because of the case mix which predominates there. They say cancer has a female face in Africa, and there's a lot of cervix cancer and a lot of breast cancer, but also quite a lot of head and neck cancers, lymphomas, prostate cancer. And many of these cancers can be treated effectively or cured with radiotherapy. So we need more.
Can you give me any comparisons, for example, how many radiotherapy machines are there in the UK or in Austria, where we're based, compared to the numbers, say in Mali?
So in both of those countries there are about 6 machines per million people. So I think in Austria there's about 46 machines. In the UK it's something like 370 high energy radiotherapy delivery machines, and that allows you to give patients whatever time they need on the machine and do these more complex treatments that are associated with fewer side effects.
So that's a huge difference.
Yes.
So even if an African country has one machine, is there still the problem with this machine
Yes.
being in such high demand?
And there are some of the countries we deal with have one machine and 90 million people, which is almost the equivalent of having no machine, but it's excellent, they're keeping it going. Mali has one machine and 16 million people. plus all those other countries round about wanting to move in. I mean, it may be more useful to look at regions. And say, I think at present there's about 4 functional government public radiotherapy machines in West Africa, which is 350 million people. If you look at East and Central Africa, about 350 million people, I think there's about 5 government radiotherapy machines.
So are people...
It's virtually nothing.
Are people basically dying just because they can't get this treatment which would save their lives?
Absolutely. A very small percentage of people will either be able to afford to go to another country. Maybe if you're in East Africa, you may even have family in India and be able to go to India and have the wherewithal. I have seen people on some of my travels when I've been in Kampala. I've seen people who've taken themselves off to the USA. So some people have found the money to do that. Occasionally governments are able to fund some people to go, but they must be a tiny minority. I mean, the cost of that is very difficult, and the logistics are difficult for a sick person. I think the reality is that most people at the moment with these cancers in Africa are dying a very undignified and painful death with their cancer without treatment.
What exactly can an organisation like the International Atomic Energy Agency do to try to address this imbalance? I can imagine it's not just the case of, say, donating a machine. Somebody needs to use it, people need to be trained. It seems like a vast undertaking. So what is the agency doing?
I think one of the first remits of this agency and why it was established is thinking of safety of the use of nuclear technology. It was realised that nuclear technology has enormous powers and enormous benefits, but also enormous risks, and that was one of the first reasons that IAEA exists. And that's still in the mix, that actually if a country wants to develop radiotherapy, we would say, well, where's the regulatory infrastructure? How is this going to be done safely? Because it's not going to benefit any patient to have unsafe radiotherapy at all, or the public, or the staff, or anyone else. So safety comes first. But then if you're a country and you want to invest, who are you going to turn to for advice? And that's difficult. Obviously there are manufacturers. There are buddy organisations who are very, very helpful, but equally may have come from a high-income country with a very different background and infrastructure, and the choices that you would make in everything about what you build, the equipment you buy will be very different in a different region. So it's very helpful to have an unbiased organisation that has seen other countries, other low and middle income countries develop services and what's worked and what hasn't, and is willing to give advice free and unbiased by any sort of commercial or political influence. So I would say that's the first benefit. Then we have access to many experts. So if a country says, well, we haven't got a regulatory structure, what do you mean? We can say what that involves, we can put them in contact with experts here, we can send somebody from there to train to be a regulator. That would be the first person. But then also the same applies for training staff to be radiation oncologist or a medical physicist specialising in radiotherapy, or radiation technologist delivering the radiotherapy.
It's quite a big. It's quite a big task. Yeah. If we look at the disease itself, we do read that cancer is on the increase worldwide, especially in developing countries. How hard hit is Africa? Not just because the lack of the facilities, but is cancer on the increase? If so, which age groups are affected? Is it men or women? So just tell me something about the cancer burden in Africa.
The cancer burden in Africa is rising sharply. To be fair, that's partly because of a success story, because it was a fairly low percentage of cause of deaths there. I think it was about 5%. Where in high-income countries, about 30, 40 years ago, I was always taught that 30% of us would get cancer and 20% of people in the UK would die of it. Fortunately, that mortality has come down a bit. In Africa that was much lower, but that was because many more people were dying of under 5 mortality, just from diarrhoea and dirty water and the sort of infant causes of death. And many people were dying of the communicable diseases like malaria and tuberculosis, and of course we then had the HIV epidemic. Nowadays we're having meeting Millennium Goals to try and bring down under 5 mortality, and we've also put out better treatments for malaria and TB, better management of HIV. But that last then means that people are living longer. They're not dying early of the infectious diseases, but actually more of them are getting cancers related with HIV. But also just more people are living longer, and that means more people will get cancer. So in a way it's not a bad thing, or it's not for a bad reason that more people are getting cancer, but it still brings a very sudden challenge to those countries to put in what are very complex and expensive services.
What about services to detect and diagnose cancer? Because if cancers are diagnosed at an early stage, obviously there's better chances for treatment. So mammography services or X-ray, CT scans, does the IAEA also help with this form of cancer diagnosis?
Absolutely. Yes, and that's a separate department to mine because I'm on the treatment side, and of course we wouldn't want you to go diagnosing cancers and not having treatment facilities, so the two have to go hand in hand. But yes, we have a department of nuclear medicine diagnostic imaging, and they support the diagnosis of cancer and the accurate staging of cancer, which shows how far the cancer's spread, and that means that they can direct you to the right treatment.
Just before we finish, you do travel to various countries, and especially to African countries. Is there anything personal that you could share with us, something which you found maybe particularly distressing, or maybe something positive, some sign of hope, something which you really remember?
I think everywhere I've been, I have been very welcomed and very encouraged by the enthusiasm of people there, and the happiness and positivity of patients. I mean, I've worked in these clinics where we have such low facilities and so little to offer, and yet the people are so grateful to you for being there and treating them. But also the staff there are very positive about wanting to enhance their services. You occasionally see amazing teamwork, and I think one of our great success stories that we all enjoy has been helping the development of the Cancer Disease Hospital in Zambia. And one of the strongest things that come across when you visit there is that everyone, the doctors, nurses, physicists, radiation technologists, maintenance engineer, are all working together and all value each other's part in the team. And that's actually very, very key to trying to push a project about radiotherapy across the finish line. It's absolutely essential.
I wanted to ask you about Zambia, because it's actually 10 years now since the Cancer Diseases Hospital. It opened 10 years ago this week. Since then, I think they've treated 16,000 people. But it's the only one in the country, so people are having to travel from all over the country. It's something like 15 million people. So what's the future for Zambia? Will it stay that way, or plans to expand?
No, they certainly have plans to expand, and they've got a very good project team. When I was there and visited for my project appraisal, I attended a meeting of the project team, and they've really got an ambitious plan for expansion to have a radiotherapy centre in every province in the next 10-15 years, but they're going to do 2 at a time. So I think they're looking at Ndola and Livingston at the moment, and they were discussing plans for the build, the equipment and the training there. Having done it once, they've got a clear picture of what this project involves. They've also been very sensible that they've actually already started training schemes for staff in radiation medicine there, again with some support from IAEA. And that's really important, because it's very difficult to expand from one centre if you're constantly having to send people out to the side of the country to train. So that was very, very key to get that going within Zambia.
Thank you. Now, I went to Zambia a few months ago, and we produced a film about the Cancer Diseases Hospital, which this year turns 10.
Vernon Kunda is receiving his 5th session of radiotherapy. The 37-year-old is one of 2,500 patients who get treated each year at the Cancer Diseases Hospital in Lusaka, Zambia. This facility is the first and only cancer treatment centre in this developing country of 14 million people.
From 2007, when we officially opened, the numbers have more than tripled. Yeah. So in that case, we can say that the cancer is on the increase.
Over the past 10 years, 16,000 people have been treated at this hospital. Before it opened, Zambian cancer patients had to join a long waiting list for costly treatment overseas. Many of them simply died. The IAEA, which supports the use of radiation medicine in its member states, has played a key role in the development and operation of this hospital.
Without the IAEA, to develop a center like this, which is highly technical, would be very difficult for us. And up to now, maybe we're not going to have this center treating the numbers that we have.
Today, the hospital's 2 teletherapy machines treat over 130 patients a day. A brachytherapy unit treats the rising number of patients with cervical cancer. The centre offers mammography services for early detection and diagnosis of breast cancer.
We are screening women in Zambia above the age of 40 years. So now how are we catching those women to come for screening? We are doing a lot of sensitization programs in the country by doing outreach programs. Apart from the outreach programs where we go in different areas to go and tell them the importance of having a mammogram, we are also using the media just to make sure that we reach out there to tell the people about early detection. We've had an overwhelming response the last 5 years from the people.
Mercy Chipampi, like many of her colleagues, was trained under IAEA programs. She now coaches radiographers around the country and teaches students from Zambia as well as other African countries. With IAEA support, the hospital is able to serve as a teaching centre for radiotherapy technicians. James Sikona uses the experience gained through IAEA training programmes to educate students. He also oversees all the radiotherapy services.
We are putting smiles on people's faces, and that goes a long way because no money can buy that. Somebody who comes anguished in pain and after treatment is able to smile and say, "I'm feeling much better," is a feeling that is just immeasurable. You can't put any value to that.
As the country's sole cancer treatment centre, the hospital needs to accommodate patients from all over Zambia and neighbouring countries. To cope with the growing demands for its services, the hospital was recently expanded to include inpatient wards. These include facilities for children who suffer from cancer and are receiving treatment. When detected early and treatment is available, many cancers are curable.
The hope is there because the time I came, I was not like this. Sure, I'm able to eat now and work. These people here, they are very kind, they are very passionate to their work. They do what they have trained for.
Elsewhere in the country, the situation is very different. At the Central Hospital in Livingstone in Southern Province, there are facilities to screen and make a clinical diagnosis of cancer and conduct surgery when needed. But there's nowhere to treat cancer locally or even analyse samples. Cancer patients need to make the 7-hour journey to the Cancer Diseases Hospital in Lusaka at their own cost, often without their families and friends. Many do not complete their treatment, some don't even start. A project is now underway to open the country's second cancer treatment centre here in Livingstone. The IAEA will be supporting this expansion. A plot of land has already been identified as the location for the future hospital.
So having a centre here shortens, one, patients' distance to move away from their homes. Two, for the hospital, so it's extremely very important because then we have the interaction, because most cancers are multidisciplinary approach to care. So the interaction between the specialties is enhanced, as well as it makes it very convenient for the patient to seek this care.
Cancer is on the increase in Zambia, with 70% of cases being among women. Most cancer patients go to hospital when the disease is at an advanced stage and often fatal. National schemes are in place to raise awareness of cancer and extend screening services. This means the number of diagnosed cases will grow even further. With the right equipment and properly trained doctors, radiation therapy is a vital component of cancer control. In the future, the people in the Livingstone area may have direct access to this life-saving treatment they so badly need.
It's good to see a difference made in Zambia. Coming up next, in September, our scientific forum will be focused on nuclear techniques in human health. If you would like to know more about this, please visit our website. Thank you for watching and see you next time.